Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Welcome back to the Functional Code, where we have episode 12 on the jaw, or the TMJ. I'm Dr. Jace.
I'm Dr. Addy, and thank you guys so much. This is another episode coming at you. We got the jaw today. I know we've been super excited to talk about TMJ issues, TMJ diseases, conditions, what have you. And yeah, this is one that I think a lot of people struggle with that don't realize other people struggle with as well. And there's a lot of intricacies when it comes to the jaw. People don't realize it's heavily tied to a lot of other things in the body, including just the nervous system and other ways about stress and things like that. And so we're ready to bring to you guys such a tremendous amount of info on the jaw. And you guys will truly take away today just how much the jaw is tied to so many other things versus just having it being just a physical structure that is by itself and has no ties to anything else. So today we have a lot of things we're going to talk about. Again, the evolution of the jaw, how we as Homo sapiens have fed, the times changed throughout evolution of what the mouth and the jaw looked like. We're also going to talk about the anatomy and the physiology of the jaw, all the tissues, all the structures involved, and how they play along with each part. Then we're going to jump into really what the nervous system's involvement on the jaw and stress and other types of chronic pain that can happen, including TMJ pain. And we're going to finish off with some conditions of the jaw that we know are handled a certain way versus the way that we would handle them. And then lastly, Doc is going to always bring up some great ways for you guys to handle TMJ pain on your own and things you can do at home. So jumping into it today, Doc, we got a good one.
Oh, this will be fun. A lot of stuff.
Let's start with just the facts and evolution of the TMJ area and how it's adapted and evolved over time.
Beautiful. And after I go through this, I definitely want to toss it back to you for like the nasal passage, because I know we're going to talk on that as well. But like when we go back, look at the structure of where our ancestors derive from, especially from the mouth and the jaw structure. There's a few fossils that they found back 2 million years ago, Australopithecus. In terms of the mouth shape, when you open up your jaw and how the line of your teeth is laid down, that is more of a circular fashion, still rounded as an oval. However, compared to previous ancestors, the jaw, the mouth was wider but thinner, which you can almost look, it has almost a direct look as chimpanzees do right now, as big incisors for breaking down meat, and the mandible is much taller in stature. And I'm assuming that is going to be more from, like I said, the chewing, the grinding of other vegetation in the area, as they were hunters and gatherers trying to just survive on the prey, on the landscape. I'm assuming based on the shape of the teeth and how the base of each of those teeth are a little bit wider, so the body was able to break down some of the greens, the grasses, some of the crops, if they had any back then. It's hard for me to say. And then also for the other sharper teeth to break down and prey for the meat. So all that, as evolution took place, the shape of the mouth then started getting wider, which first off, it affected the size of not only the jaw, but when the head When the head also grew, it forces the jaw to retract backwards instead of coming forward like a ape or chimpanzee would look. So I think the jaw also has a direct correlation to how the size of the head is, just to compensate of how your head holds itself up on top of the structure against gravity. Like no, I don't think we were able to evolve with a huge mouth chin unless we didn't have the resources we do in agriculture today and how we can break down processed food. But with that being said, between those two structures coming back, the size of the head expanding, and as that process happened, similar aspects occurred to the nasal passages as well. Doc, I don't know if you looked into some of this, or I guess what's your thoughts with the nasal passage cavity?
Yeah, so even like Doc was saying, as we continue to consume food differently, especially when we evolved to have fire and we were able to cook food and we were able to consume food faster and easier because we were able to break it down and cook it, we were able to eat so much more. And what happened was our brains start to grow at a size that our bodies weren't prepared for. And as the brain grew, it needed to create space somewhere in our structure of our skull. And so we started to grow a nose, and we started to have to go more widened this way to make room. Now, the theory on that is because we evolved so quickly, as we elongated frontally, it made us worse breathers, is the theory behind that. So yes, we had to make room for our brain, which is important because now we are by far the most intelligent species on this earth. However, they're saying that because we grew a nose and we now have less space where basically the middle portion of the skull was, it created a worsening effect for our breathing, which there's a theory that really never did change, and then there's a theory that it did change. So we're still trying to understand if we are worse breathers than we were, back in those times. But what I think we do know is the way that we now can feed, which is on ultra-processed foods that are much softer, you'll see that we have a lot more issues with malocclusions. We have a lot more issues with palate formation, and we just aren't seeing healthier jaw and or nasal passages because of the way that we used to feed, which was heavier chewing. We had to break things down. We were able to train these tissues and these areas much more appropriately, and that's where we now are seeing issues with those needing more braces, even like palate trainers and other things where we need to start pushing the mouth out so that we can drop the palate and have a more appropriate nasal passage so we can breathe better. Then we have, of course, other issues with deviation of the septum and just all of these other things that we don't know to why we're seeing so much. And a lot of people are theorizing that it's because we feed our babies softer foods once they get of age to eat food, versus if you see tribes people in Africa or other sectors where they're doing research and showing that a lot of these infants are being fed very tough structures like jerky and meat and apples and just harder things to eat. But of course that's causing them to have to work harder to chew and understand just how to play around with that. So there's a lot going on with the evolution, I think, understanding what happened to now. But what I think we do know is we are worse off with the structural changes that are happening versus what we used to have.
Yeah, especially with the jaw. And I never thought about that point, like from kids chewing and how they even got resources in their body with the stuff that they had.
Right.
That's such a good point.
Yeah. And so I think the most important thing is to know what are some helpful ways to avoid that. And that's, again, giving them foods that are maybe a little more difficult to chew, but not thinking that it's going to harm them. Just obviously keep an eye on them, but let them play around, let them chew, let them start to work those tissues, because I do think it is healthy for proper structural changes.
Yeah, and then even if you are wanting to attempt that as a parent, obviously be very cognizant because choking risks, of
Right.
course, we want to bring that up. But yeah, no, that's a darn good point. I think anytime we can go back to the ways where our ancestors lived and how they lived in all aspects, I think can give us a good insight to how our bodies formed and are functioning.
Yeah.
So yeah, that's a good point.
So when it comes to the jaw itself, there is a lot of structures at play, and so Doc is going to do an amazing job of breaking it down. It seems to be a small structure, but what you don't realize is just how complex it is. So Doc's going to take it away and explain this amazing physical structure. But again, just to preface, if you guys have questions or need any other further breakdown, please let us know. But he's got a great breakdown for you.
Yeah, and I was talking to Doc earlier on the podcast. I'm like, how am I going to make this simplistic without going too in depth? So just that being said, we're going to do the best we can. So let's start with the bone structure. So if you think of your cheekbones, it connects into the temporal region of the skull. Now that has a very close proximity to the mandible or your jaw or chin. So as you open and close your mouth, those structures have to move and glide on one another. And in between those, which helps it glide, there's a small disc. So as you open and close your mouth, and I'm going to get into the mechanisms of how that works, as I think is everyone chews, talks, uses this joint on a constant basis. We have to understand what it is, and then do we have to make certain altercations, pain or not, for the maintenance long term, which again we'll get to at the end. So this disc between the jaw, chin bone, and the mandible, and the temporal region of the skull, that disc, it almost mimics to a certain extent the kneecap and how you bend and straighten your leg and how that kneecap slides back and forth depending on position. Very, very similar to how the disc in the jaw works. There's not many other joints around your whole body that mimic that, but I think that would be a really good comparison. Now, in terms of the musculature around the jaw, we're going to start kind of more superficial and then go more deep so you guys have a good idea. So there's the masseter, which if you push on the outside portion of the outside angle of your jaw, that is a muscle that can be tender for some people. It helps break down food for more of closing. If you clench your jaw, if you're stressed for a period of time, that you can also have some achy tender points in that area. Now, as we go more above to the side of the skull, there's the temporalis, and that helps retract and helps closing of the jaw. So, and we're going to get into some pin and stretch movements with that, but that connects back down to the mandible. Now, as we go even further, there's muscles on the back side of the angle of the jaw, and that's what's known as the medial pterygoid muscles. That helps with the deviation from side to side and a little bit of opening and closing. So if you notice your jaw, when you open and close, deviates to one side, that's an area that you want to pay attention to. Now, the other structures which help open and close your mouth primarily are the lateral pterygoids, which connect to the sphenoid and all the way back down on the opposite outside portion, almost deep below your cheekbone. The only way you possibly physically can push and manipulate or treat that area is you go down right below the cheekbone. You have a thumb's length backwards towards the ear, and then you're going to notice a little crevice right in front of the earlobe, a little lower. If you push in that area, open and close, you can get that lateral portion, so the outside portion of that lateral pterygoid. Now that one, when you look at the anatomy, we're going to have videos and pictures up. There's a lot of structures overlying it, one of which the masseter is going to be huge. And then there's a lot of arteries, nerves, some lymphatic tissue. So when you're pushing in that area, it can be very tender for most people. And there's a lot of guarding instincts there, which if you look back on how the body wants to protect the deeper structures and joints, it does that by way of layers of either tissue, layers of vasculature, lymphatic tissue, glands, and whatnot. So I think it's there for a reason specifically, so the body can protect it, because how important it is to open and close the mouth. The body wants to protect all the resources. Same with the nerves and how it comes out of the spine. Everything's protected in terms of layers, in terms of bone structure, and then smaller tissues laid on down from there. So as we look at all those structures combined together, those are the main ones. On top of that, the tissues on the front of the neck attaching to the bottom of the jaw help for tongue movement, retraction, and there's other aspects that help in terms of the jaw movement coming down, which we'll get into a few of those here in a sec. Now let's look at how the jaw opens and closes. So, and there's going to be videos on this, because this will make more sense with other conditions moving forward. So the condyle, which is pretty much connected to the cheekbone, the mandible, that in order to open, that mandible, that little circular top portion, has to slide down and rotate forward and then slide back up. To help that, like I said, there's that disc. So there's a ligament, or what's known as a lamina, retrodiscal lamina, that is on the front of deep to the side of the ear. Now that helps hold the tension, so much the same with the knee. And we straighten, extend, there's different pulling mechanisms so the kneecap doesn't slide in various areas as you bending and extending. Same thing with the jaw. So as we slowly open, as that condyle slides forward, that there's relaxation of that ligament, and there's muscle activation of the lateral pterygoid pulling it down. And then in order for it to come back up, the superior helps it ride up until it has to go back up over the ridge. Now you can get into other problems and other conditions, especially locked jaw or disc displacement. If there's any excessive pressure, pulling, damage to see that back ligament, superior retrodiscal lamina, that's going to be one thing. Now to keep that disc kind of in alignment, there's ligaments on the inside and outside, and also there's an inferior retrodiscal lamina which holds it on the back side. So that way the disc doesn't slide in and out, even if you shift your jaw side to side. There's just ligaments that help support. Again, much the same, not necessarily with the kneecap, but to other structures in the knee. So like when you walk, move, your knee doesn't give out and you fall, more or less. So as we go into then closing the mouth, that top lateral pterygoid starts to contract and then it has a little bit more of a recoil back into place from the back ligament. Now there's much the same with like the hip joint, there's a pressure buildup in that joint. So every time you open and close, it creates almost like a suction feeling. And if there's problems to the vasculature, or if there's excessive movement of that jaw or that joint, that pressure can get offset, which can create other problems and increase vasculature, which can hold up in that backside of the jaw, and which can also lead to locked jaw. Like I said, we'll get to that here in a sec. So I think that is really important as you open and close your mouth. And I would highly suggest, if you're just listening to this, tune in, look on YouTube, Spotify, wherever, and actually watch the videos. It'll make a lot more sense as I'm kind of talking through this, because seeing this with a lot of these fancy weird names, it's hard to comprehend. So let's go into the complex of the neck muscles and how that affects not only swallowing, talking, breathing. The one huge aspect I want to bring up is the hyoid bone. I spent a lot of time looking at this, not only in the last week, but also the last couple years. The hyoid bone is the only free-floating bone in the body. It doesn't connect to any other aspects other than tissues, muscles, tendons, some ligaments. What is the actual purpose of it? I think one of which is a tension regulator. It helps in, much like I said, swallowing, digesting food, bringing food from the mouth down, helps facilitate more so. And then also with certain muscles connecting from the ribs to the hyoid, the sternum to the hyoid, it helps stabilize a large portion of the tissue tension. So when I look at this, I also compare this to some of the muscles on the outside underneath the collarbone, known as the subclavius, and how that muscle runs directly in line with the clavicle. And why was that adapted? Why do we even still have that? Now we know for sure that based on the muscle lines of communication, it helps regulate the anterior portion of the shoulder and the AC joint. So there's 3 muscles that connect from the styloid process, which is almost like a tooth-looking structure right below your ear. It's really deep. It's hard to get to. Unless you're pushing right below the earlobe in, you might feel a lot of pressure, like a hard structure. That would be your styloid process. I actually came across this other time in terms of Eagle syndrome.
Yep.
And how that styloid process can get elongated. Thus, if that is the case, in terms of adjusting, it can cause pain, which I think also, if we have excessive pressure going down to the front neck, there's going to be a lot of guarding. So when we look at this, the hyoid bone and how there's, like I said, 3 muscles mainly that attach up to the styloid process and then down to the hyoid bone. And of those are, one of which is the stylohyoid, which, if you think about this, is innervated by cranial nerve 7. There's also another muscle that comes down, stylopharyngeus, and which helps elevate the pharynx, which helps for nasal regurgitation, so it can hold that pressure in the back of the sinus cavity. And then it also helps with the larynx and talking, so that is innervated by cranial nerve 9. Now then there's another muscle, styloglossal muscle, which helps elevate and protrude the tongue, and that's innervated by cranial nerve 12. So cranial nerve 7, 9, 12 is all innervated by muscles attaching right below the ear at the styloid process. Looking at this last night and over the last few days, why has the nervous system adapted and have tissues come straight through one point and one bone to where we didn't even know the purpose of it other than the connection and other conditions that can come from it, and how that connection goes to the hyoid bone, which is a free-floating bone. If that was connected to a joint, this would be a much different story. But based on the tension regulator from not only the nervous system down, but also the tissue tension, let's say if there was an impact, like we're in a fight, so you get hit in the face, maybe you damaged maybe the styloid process, maybe the jaw mandible. How is the guarding tension coming, and how is the hyoid bone set? I would assume that's going to be a lot of compensatory or compensations to the opposite side. So if there's people with forward head posture, which can lead to other problems, that tension of the hyoid bone will retract back and up, which is fascinating enough. There's a study back in, what was it, 2017, in terms of the relationship of the jaw opening and the hyoid bone dynamics in elderly adults, and it pretty much stated that the hyoid bone prevents aspiration when the hyoid bone is elevated. So in older men, they found that there's a lower hyoid bone, which is much easier for elderly men to aspirate, especially when drinking, eating food, which other symptoms, I'm sure people just chalk it up to age, which I'm sure it is, but in terms of the strength and the tension regulation, that just tells me that this bone shifts depending on age, which can affect all the other symptoms. So not only do we want to help stabilize, strengthen all the neck muscles, we also want to pay attention how that's affecting your head over your body and other problems going out from there. With the hyoid bone, also from top down, it also has connections between the omohyoid, which goes from the bottom of the chin, hyoid, to the scapula. It has connections, like I said, to the sternum, to the ribs. So it is connecting everything as a whole, much the same with like how the pelvis and the abdominal tissue connects the legs to the torso, to the upper back arms. There's a lot of small tissues, structures in play all through that one bone. And fast enough, it has, like I said, a lot of nerve innervation as well. And the last one I want to bring up is the digastric muscle, which goes from the chin to the hyoid and out and follows the stylohyoid muscle. So when I look at in terms of opening and closing the jaw, a lot of that tension can be regulated going back in that same following connection of how the hyoid bone is set in the neck. And at the end of this podcast, we're going to go into strengthening aspects. We're going to take in consideration the whole line of tissue, not just the hyoid bone to the chin, or not just the muscle, the SCM, which goes to the front. We're going to look at the layers of tissues, and we're also going to be very specific to how you can regulate and target if you do have some of these problems, and how you can assess some of this stuff moving forward. But I think this is a perfect segue, especially with how the neurology goes through certain points of the jaw or proximity to the jaw, and how that affects the nervous system. And Doc's going to talk here in a sec on how central sensitization plays a huge factor with many other conditions, not just relating to the jaw, but how everything kind of brings together. Oftentimes we see if someone has chronic pain or other problems throughout the whole body as a systemic aspect, oftentimes you have to either look to the jaw or other factors closer to the brain stem. So Doc, central sensitization, how does that play into this fact? What's the knowledge that you have on that?
Yeah, and that was beautiful, by the way. And I think that only helped me even understand further just how much the TMJ area is so connected to every other part, up and down. It's crazy. And I, again, what Doc was talking about was just how certain parts of the TMJ have straight from the nervous system. He had mentioned the cranial nerves, and they are connected to the brainstem. They come and out, connect to those tissues. So there is a literal feed from the nervous system to those tissues that are close to the TMJ or work with the TMJ. And like he had brought up, why would the body do that? And that was a good question. It's interesting how this body of ours has been created, and some of the questions that you can come up with. And I even remember, what was that famous tool that bodybuilders do where they clench to create more strength? Yeah. Well, there's like these big rubber pieces. When you bite down onto them as hard as you can exert like another 20 to 30% more power, even with your squat. And so the ability to clench hard almost causes this nervous system stimuli to create an upregulation of your nervous system. And with that change in messaging now gives you the ability to perform better.
That's a good point.
Yeah, and so
I wish I looked into
these
that.
bodybuilders are taking these hardened pieces of rubber and clenching as hard as they can, and then do a squat, and their performance increases by like 20-30%.
That's crazy.
Yeah.
Oh, I've heard of it.
So now I'm only asking myself more questions of, why is it that this structure is so heavily cemented into our nervous system? It's really, really interesting. So
Fascinating.
back to central sensitization and what Doc was talking about, there is a condition that I would say is newer to our understanding of why we are having certain issues with pain. And this idea of central sensitization, probably within the last 5-ish to maybe 10-ish years. I know that pain studies have been done on this, a long time ago, but we really only started adapting or understanding it within the last 5 to 10 years. But what it is there are times where our nervous system can become more sensitive. And when we have a more sensitive nervous system, what can happen is our nerves start firing messages when they maybe shouldn't have, and specifically the pain nerves. So what will happen is normal stimulus like touch or even just a poke or something very little can actually then cause your pain receptors to message your brain and say, hey, we have an issue here. When in reality, that light pressure is not painful, and it shouldn't provoke this heightened sensation of pain. So what we're finding is there are roughly 10-ish conditions that have this same nervous system structure breakdown that we're starting to understand. And we're starting to see that there's actually common symptoms between all of these conditions. And a lot of these patients that have one of these conditions have similar symptoms to the other. And there is also a more frequent or less frequent breakdown of those symptoms depending on what they have. So for example, some patients have chronic widespread pain, stomach issues, sleep issues, jaw issues, right? Now let's say in those breakdown of symptoms, the only one that they present with mostly, but they do have every now and again symptoms of stomach issues, sleep issues, chronic widespread pain, but primarily they just talk about their jaw, they're going to be labeled as having TMJ. That's the condition. But we miss the fact that they had the other symptoms underlying. Now, let's say a patient comes in saying, I have pain all over my body, including my jaw. They have some stomach issues, some sleep issues. That is fibromyalgia. But what they didn't realize was there were those other symptoms involved. But it's easy to forget the secondary or tertiary symptoms when someone's coming in and saying, my primary issue is this, please help me with this. Okay, yep, you have fibromyalgia. They don't even address the fact that they're not sleeping and have other issues of diet and stomach issues. The last one is you have wicked stomach issues. You're not sleeping because of it. Probably have some TMJ pain or pain elsewhere, but they call that IBS. You see this pattern, and that's what they have with these 10 conditions, which some of them are, again, PTSD, fibromyalgia, chronic fatigue syndrome, IBS, tension-type headaches, migraines, TMJ, restless legs. Again, they're seeing that patients have a lot of these other symptoms. And why they have a lot of those other symptoms is, again, just this concept of their nervous system is so heightened to stimuli that it presents a certain way in some patients and a certain way in other patients, but it's the same concept. Now, why would something like this happen to a person? And what they're theorizing and understanding is there was so much trauma to this nervous system at an early age that it doesn't have the ability to regulate moving forward. And so they've tracked back and stated that they had came from a place of either physical, mental, sexual, verbal abuse under the age of 10 growing up, probably lived in poor health, poor socioeconomic status, maybe had poor diet, but a lot of it came from a huge tie to a traumatic experience early on in life, and even multiple traumatic experiences early on in life, which makes sense because it threw the nervous system off so much that now it doesn't have the ability to regulate. Case in point, why stress is such a huge contributor to TMJ makes a lot of sense, especially when we know that cognitive behavioral therapy and a lot of other types of stress therapies can help with TMJ. Well, not only that, it can help with a lot of those other conditions because it is more of a nervous system issue than it is a physical manifestation. So where is that something that you need to realize is a lot of these conditions and the way that central sensitization works is it doesn't have anything to do with external stimuli. It's all internal stimuli. It's all an internal response. So TMJ, okay, is it actually, and not to say that there isn't physical manifestations after a while because of all the stress and all of the grinding. Yes, eventually your teeth start to get indentations in them and your jaw starts to become wore out because you're clenching so much. Yes, there is physical manifestations, but in a lot of these other cases, there isn't. It's just this idea that there's an external stimuli happening and you're responding to it negatively, when really it's just normal stimuli, but you're responding to it so much that there's pain. So a lot of this with IBS, right? Like some of those patients who have IBS, they're like, I can't eat anything. I can't even eat vegetables. And it's like, well, it's not that vegetables are the bad external stimulus. Vegetables are good for you. It's you just are so heightened to that stimulus and now you have pain from it. So a lot of it is probably could be spoken about at a later podcast with maybe pain and just breaking down the nervous system. But where I think we need to understand when it comes to TMJ pain is there's a lot of ties to this nervous system of ours and making sure that you have appropriately regulated this to a point where if you are having pain every day in the jaw, start thinking less of, is it just because I chew a lot of gum? Well, it could be. It absolutely could be. But taking away the gum, does the pain go away? I'd have a hard time believing, unless it's truly like you damaged your tooth. There's probably a lot more going on with this jaw than just something physical. So taking away, really what I want patients to know is there's going to be a lot more nervous system or stress issues, I think, than you realize with TMJ. And if you're not taking care of that portion of things along with, everything else, it could be quite a struggle to take care of this jaw pain.
Yeah, and Doc brought up, God, so many awesome points. Like, I definitely would suggest rewatching just that small section. It sounds complex, and from a practitioner's standpoint, I'm thinking about this. Okay, us as doctors, thinking about multiple things at once is just difficult itself. I can't imagine a person Googling, oh, I have this condition, this condition, this condition.
Right.
And you might, but how is all that brought together? Like this, we're not trying to make this into a simplistic answer. It's just there's a lot of correlations to how the body functions. And even going back to the point that he said as well, a lot of this manifests more internally. I think that has way more of a fact that we have to dive into the areas of our life that we have swept under the rug from either child abuse, from stuff at an early age that absolutely have to get brought back up. Because if they keep manifesting and stirring, I image it almost like your nervous system has to spend a little bit of energy for a long period of time just to hold that internally, to where if you're able to let it out, it can help relieve many other symptoms throughout the body. I think is something that psychologists are definitely a needed topic, and they're not just shrinks, they're not just someone that, I just want to go talk to the problems. They have specific ways and tools that they can bring some of these things out to help with physical symptoms as well. So,
and a lot of people too, that's a good point, because a lot of people are like, well, I don't know why, I'm having these issues. I'm not stressed. And if you truly think that, I don't think there's a human on earth who doesn't experience stress every day. Stress is many, many things. It can be more than just what you would picture as stress, which is you're pulling your hair out and you're frustrated and you actually are exhibiting more severe emotions. That's severe stress. Now, even simpler stress can still contribute to these issues. And so when you're saying I'm not stressed, you should look at it and say, how stressed am I? Because there is still stressors put on you every single day, whether you want to believe it or not.
Yeah.
And by far one of the greatest ways to manage that is to talk about it, to acknowledge it, and to accept that we're all humans, and the longer that we live our lives on this earth, the more chances and times we're going to be given scenarios that put us under a huge amount of stress. And that's, family deaths, other, relationship issues, work issues, you name it. There's going to be times where you're going to be severely stressed. And if you don't properly handle that at that time, it's only going to continue to build as other stressors come into play. So
life's tough.
Yeah, it is.
Like, if you're younger and you're watching this, going through school and people are helping you out or not, it gets way more difficult as you go throughout, the more responsibilities you get. And even talking on the point on stress, there's good stress, bad stress. Obviously, we're talking on the bad stress, let's probably get into that later podcast. But living the amount of time that we can on this earth is a joy, but there's so many challenges that can come from it. It's how can you have the best time that you can to make the best imprint long term, and then have people around you to make it enjoyable.
Exactly, and that's huge. People.
Yeah.
People. And someone told me this a long time ago, which was, you can make all the money you want and live in that big fancy mansion, but when you're there alone at the end of the journey, it can get pretty lonely. And I had to realize that, because it's easy to get tunnel visioned and forget about the people that are most important to you on the side. And you just want to make sure to make time for people, because people are everything. And then if you're introverted, it's probably a little bit harder to understand that, but there are still times where you absolutely need support systems. You need people to help you through things and make sure that you are putting the right amount of effort into the people that are there for you, and I don't think that's a foreign topic. So
Well stated.
Yeah.
I can relate.
anyway, so I think
good.
we dove deep onto that one. We're probably going to come back to that. That sounds like that's probably going to be a good podcast in the future. But yeah, this will cause, eventually the stress will cause physical manifestations like we talked about, but taking care of it beforehand is only going to make it better, so you don't end up getting a lot of these conditions that we're about to talk about because of the amount of stress and just tension and issues moving forward. So, Doc, first thing we have down here today is disc displacement. And you want to just talk a little bit about what can contribute to that, what happens, some presentations of that, and then how do patients take care of something like that?
Absolutely. So when you look at disc displacement, again, going back to the anatomy of that disc between the mandible and temporal bone and how you open and close your mouth, that disc can get stuck forward, which is most common. Now, that can bring about clicking, it can bring about grinding, pain in the area. Oftentimes, this can be brought up from either fighters, MMA, just constant trauma. It can also be due to motor vehicle accidents and whiplash, especially severe whiplash, which can jam the jaw and that joint back into the socket, which can affect the pulling tension on that back ligament, superior retrodiscal lamina, and then force the disc to get stuck forward. Now, it takes months for sometimes to heal that, but you need less pressure on that. So there's studies on this and lockjaw with just mouth guards. When you look at mouth guards or night guards for more purpose, it allows not only to gap in the jaw, but it also allows for less pressure on the backside and in that joint cavity, which can help restabilize and bring a little bit more blood flow to the back disc in that whole joint. So there's a study in 2019 by Lemus et al. Just stating the fact that management and massage therapy and physical therapy with certain exercises can help retrain that disc to come back, thus so that disc doesn't get stuck forward, thus less pain and grinding, popping, clicking tension. But
Yeah, and that one is probably a little more common than people think. You know, the clicking and the popping, I think a lot of people have that versus they think it's probably something minimal.
Yes.
But that is something that if you've already gotten to that stage, you might want to go start thinking about working with a practitioner to get that under control, because if it only is going to get worse, it's really difficult down the road to try to manage that by yourself.
And it can come up as well. Like if you feel stressed or if you feel like you're clenching, first aspect, notice it, recognition, awareness, biggest thing. Ideally, a good tool for this is at nights when laying down, just try to have your jaw relaxed. With your hands, just go side to side movements. Even holding underneath the jaw, open and close, side to side, can help loosen up that tissue. But a lot of it will come down to just relaxing for a period of time. Just have your jaw kind of open up. That'll help quite a bit for just disc displacement itself. But,
I actually was grateful enough to have a friend of mine in chiro school tell me that I'm a clencher. And I had no idea. And I wish I would have known a lot earlier. So if you see someone clenching, ask them if they know that they're a clencher, because that's helped me out tremendously, knowing that I have an issue and needed to kind of get that facilitated. So no, that's a huge contributor, especially when you're continuing to put so much pressure on that disc in the first place.
Oh God, yes.
Next up is something that's probably very similar to it, or at least can present similarly to that, Doc. So lockjaw, how is that different and or has similar changes with the disc displacement?
Yeah, so this one can be scary, especially if people like either wake up and they can't open their mouth or their mouth's open, they can't close it. Again, a lot of it comes back to the disc. Now, with lockjaw, most often it presents if you have limited space in the cavity, so there can be arthritis and degeneration broken down in that joint. It's very rare, but often lockjaw can be signs and symptoms of the arthritis taking place. It's pretty much where that disc, because the pressure is put up on the top portion of the condyle so much that it can't slide properly, so it gets either stuck back or forward. It can also mimic symptoms of anterior disc displacement to a certain extent as well. So there's a few different ways that you can go about this, some of which just retraction of the jaw or trying to relax your jaw, kind of like I said, go side to side. Night guard works really, really well. There's, a study that we had in here in 2000 based on the long-term effects of using night guards to prevent lockjaw episodes and improve all aspects in terms of pain function, frequency of it happening. And then there's another study in 2019 as well that physical therapy interventions can also help with the tension. When looking at some of those studies, they did some of the basic exercises. They also did a few other things in terms of stretches, but I don't think they're specific enough, at least on how the studies were stated, on tissue targeting and how certain aspects of certain tissues of the joint can be worked on and trained. So it probably can be much quicker, faster results that we probably don't have yet. But yeah, a lot of it's going to be night guards. A lot of it's going to be some manual pressure, pinpoint release, like a pin and stretch or pin and open and close your mouth, bring it side to side. And then certain exercises against resistance will help quite a bit there. But it takes some time. We're talking weeks, if not a couple months, to decrease the pain. But that's where you definitely, if you start having lockjaw, you want to go see a practitioner sooner than later, because it's really hard to do some of these manual stretches, exercises on yourself, because when you do and try to go through manipulation or try to go through some of that, there's some guarding tension that you can't relax enough in order to induce change. You have to have someone else do it for you, and that's where the question comes on what structures are involved, how did it present, was it a trauma to the area, are you a fighter for years on end, you 20 years off, you're 60, 70 years old now and you're having these weird symptoms. Like, a lot of it can present from many different areas, but yeah, I guess that's lockjaw in itself.
Yeah, and that one I've never had, thank gosh, because I've heard it can get incredibly scary, and it can take some time for that jaw to actually get put back into place too.
Yeah.
I would only suggest to have someone help you out once you have had something like that happen to you, because like Doc said, just the thought of trying to manage that by yourself, you're going to already be in a stressful state. I doubt you'll be able to really lower that guarding yourself. You're already probably heightened and worried. So go ask for help. So the next one is one I think most people have heard about or even know someone who does this. I have bruxism, but bruxism, Doc, teeth grinding.
Yes.
What are some of the main things that people need to know about bruxism versus just maybe some of the already things that they know about it?
Yeah, oftentimes this comes in stressful states, like bad stress states that we kind of already touched on. Some people naturally, when I think about the grinding of the teeth and how you can go about dealing with stress, some people naturally, they tend to carry their stress, maybe not in the upper back, but more in their jaw, just clenching. This can also come, much like Doc said, when you're sleeping and you can grind your teeth at night. That's where night guard works incredibly well, so you prevent any dental issues moving forward, malocclusion or misalignment of the jaw, forward, backward, side to side. And then we're going to get to sleeping positions here as well too. But yeah, I think the biggest thing is going to be decreasing stress. I know they have a couple other studies, because when you look at the conditions of the jaw, what are treatments that can possibly be done? And I'm sure there's more being experimented on that. There's not as many quality studies, but there's one that they did Botox versus a placebo. I think it was just saline, if I remember right, and this was back in 2018. Botox had a better improvement of symptoms, less pain compared to the control trial. I think there's other ways that you can go about that much easier and better, but a lot of which is how well you can deal with that stress, and a lot of it's going back to just relaxing the jaw every time you're on the road or laying in bed. But yeah, Doc, is there anything else that I guess you have for teeth grinding?
Yeah, I think some things that I've started to learn over the years managing this myself and then just reading about it. There's a lot of correlation to not only stress and bruxism, but obesity and bruxism, poor breathing and bruxism.
Makes sense.
You're going to have similarities with those who are drinking more in bruxism. Just, again, poor weakening. When you drink, there's just poor weakening tissues in the throat and the mouth. And so those who are snoring, bruxism, there's a lot of those kinds of ties. Now, I think the biggest thing for people is before you start managing stress and you have heavy signs of bruxism, get a night guard first, because it may take some time to really downplay that nervous system. And there might actually be, it might just be something you have to manage throughout your life, because again, like before, we're going to have stress throughout our life. And so you already have a tendency to clench, then a night guard is going to be something that's just there for you and you don't have to think about it. Not to say you shouldn't handle your stress as well, but I do think it's helpful, because if you go for so long without a night guard like myself, now I have what the dentist described as craters in my teeth, because I had been grinding for so long and clenching for so long without knowing. So that's only going to cause issues down the road, which it has. I now have teeth pain every day, at least one tooth, which I've been dealing with for years. And I know my clenching is worse when my tooth is more painful. And I know that I need to do a better job of wearing my night guard, managing my stress, because I know my jaw and or tooth pain gets worse. It's kind of like a little, what I would call a gentle reminder as a joke. But there are definitely huge ties to stress, and making sure that, even especially in kids, because I don't know how many times I've heard parents tell me that I can hear my kids grind their teeth at night, and I'm like, gosh, get them a TMJ specialist or dentist right away, because it's only going to continue. So make sure that you get that handled as soon as possible, because that's only going to benefit them as they move forward. Again, I have a deviated septum, so I don't know if there's any ties to changes of structure there. I needed braces as a kid. I don't know. Everything we kind of just talked about was now tying to some of these things we talked about in the jaw. It all has a tie. It all has a tie. But the last thing I wanted to talk about was just cognitive behavioral therapy. Again, it's just a helpful way to manage stress. It's a great treatment. Has great research showing the efficacy of managing bruxism just after, I think it was like 6 or 8 sessions. So
Wow.
I don't know how many times we've talked about stress on this podcast, but if you haven't found out yet that managing your stress helps your jaw pain, I think you need to finally realize that now. So
Yes.
next up, this is a good one too. Tension headaches, by far the most common headache. We've talked about this on I think it was our neck podcast, right?
Yeah.
Yes.
Yeah.
So this will be just a nice recap of that, but we're going to also talk a little bit more about how it ties to the jaw. Doc, what is tension headaches first, and how does the jaw tie into that?
So oftentimes when you have tension headaches, you're going to feel discomfort around the base of the skull. It can come across on the sides as well. That can be due to stress. It can be due to subluxations or misalignment of some of the vertebrae on the top of the neck, which has guarding tension. It can come from even other stressors as well. And how it's connected to the jaw, if you think, and we're going to have a picture as the diagram comes up here, going back to computer posture and seated posture. If you're here for a period of time with gravity constantly placing down on us, over time, if your head starts coming forward, or your forward head posture, what's going to be happening? Well, one of which the body has to hold the head up against gravity. So what is it going to do? It's going to hold a lot of guarding tension, upper back, shoulders, thus where people feel like they're carrying stress. It's also going to put a lot of pulling tension and jamming tight tension at the base of the skull. Okay, now how can the body hold the rest of the head on top of the structure? Looking from bottom up to the chin. First off, the hyoid bone is going to start to retract and come up tightening up some of the tissues on the bottom portion of the chin. There's going to be some tension underlying going down, especially from your chin to your sternum, because if this becomes tight, or if you're sleeping on your side and everything's balled up, that is also going to lead to jaw pain thus. And again, we're going to get into sleeping positions, because if your head shifts off to a side, it can also pull the jaw with it. As we spend a lot of time in front of us, we also want to make sure we spend enough time working in the complete opposite direction. So combating gravity at all times, forward head posture, seated, computer work, we have to go about that the complete opposite way. But yeah, if we're jamming at the top base of our skull, we're weakening tissues on the front of not only our chest, rib cage, between the chin and also sternum. And that'll affect other symptoms, even going out to the shoulders, down from there. But yeah.
There was a good study that showed weak neck flexion as a marker for those who have tensions type headaches was like 4 or 5 times higher if you had weaker neck flexion. Again, if you're continue to be at a forward head posture, these tissues will eventually get weaker. And those who failed the neck flexion test, which I believe was trying to, if you're laying on your back and you try to lift your neck up and try to hold it for a minute, if you failed that test, your chance of getting tension type headaches was like 4 or 5 times higher.
That's a good, yeah. Yep. There's also systematic reviews of research done on the connection between these two. So there's a lot of studies connecting these two. How you go about it is a different way and specific for each person, but yeah, absolutely.
So the other tie to the jaw is going to be the nose and the mouth. And I think I've talked a lot about nasal breathing, I think on our sleep episode. So if you really want to dive into that, please head back to that podcast. I'm going to do my best to review the nasal breathing today, but I'm going to tie it a little bit more to the jaw. And really it's going to be tied just as how we've been explaining it, which is going to be more stress related. So when it comes to nasal breathing, we want to make sure that we are always nasal breathing as much as we can. So there are times when we're sleeping and either through allergies or just poor structure with, like myself, deviated septum. If you've been drinking, you're way more prone to be a mouth breather. What you're gonna find is if you continue to mouth breathe, it actually has a correlation to be having more poor outcomes on health when you are mouth breathing more frequently. Anything from developing more respiratory infections, COPD, asthma, to it can actually there are even ties to increasing the chance of obesity. A lot of risks and precursors to poor health outcomes if you're a mouth breather. So for sure, in concept to what we're talking about, when you start to breathe through the nose, you are activating the parasympathetic system more, which downregulates the nervous system, improving stress and managing it that way, which again now then will tie to helping out with TMJ and or jaw pain. So I'm not going to go into the grand benefits of why you need to breathe through your nose, but the two things that I think I want to touch on is, again, activation of your parasympathetic nervous system, promote relaxation. The second thing is it does, like Doc said, help support proper posture of the mouth, the tongue, and the dental arch, which is incredibly important for all those reasons he had mentioned, which was when we sleep at night and there's a nice opening, there's no stress on the jaw. It also can help breathe through the nose, all the other things that it can do. We want to make sure that we are appropriately putting effort into making sure that we're breathing through our nose. And if we are a mouth breather, to stop that as soon as possible. And there are things that you can wear to help at night. Nose strips are super helpful. That's what I like to wear. I'm using a product now called Intake Breathing, which is a magnetic pad where with like a typical nasal strip, it has just one adhesive along the entire strip. And that can get, for me, it can get pretty raw on the top part of my nose when I'm using them every day, versus I'm just putting a pad on each side of my nostril, and it has this very hard bendable strip that has magnets on the end, and so it clips right in, and then it's hardened, so once it clips, it widens out to expand my nasal passage. So it doesn't have any adhesive or any touch on the top of my nose, so it's actually really helpful, and I've been using it. I like it way, way better. So that's just something for you to take. Again, you can do mouth tape, which actually just closes off the mouth when you're sleeping, can help too. But yeah, that's something you want to make sure to assess, because long term, mouth breathers have huge ties to sleep apnea, which again, if you're not breathing at night, that's already a huge issue. We don't want to get into that down the road. Go to the sleep podcast too to look at that. But with the nasal breathing versus mouth breathing, you're going to have, again, more chance of respiratory infections, nasal passage, occlusion. All of that's going to tie to the jaw and the mouth, which again could cause increased tension. It could cause all the things that are going to contribute to worsening jaw pain. And then lastly, it can promote inflammation of those areas, again, of the jaw, the mouth, the nose, and reduce sleep quality, which again, if we're not sleeping, we're not healing, it's only going to contribute again to the worsening structures that are going on at play. So,
especially with the environmental factors, like let's say you're sleeping with dust mites or you're sleeping in a poor environment. If you are breathing through your mouth, that's going to affect, like Doc said, all the inflammation throughout the whole body as a systemic wide and also at that area as well.
And that's a good point, because the nose is designed specifically to help with that. When you breathe through your nose, it actually, one, helps humidify the air, but two, it can help deter or prevent any of those allergens, pollens, to all the way come into the body, because as it goes through the passage, there are protective structures in our nose to help try to stop all of that from coming in. It's a defense in a way. That's also important because your mouth doesn't have any of that, so you're taking all of that in. Lastly, stress and how that can contribute. I don't think I need to touch on that. We already know. I think I've said stress like 1,000 times today. I'm going to touch on when it comes to stress, or just things that we haven't yet. So when it comes to altered pain perception, there are studies showing psychological stress can actually alter how you perceive pain and sensitivity. Again, just like we talked about central sensitization, making individuals with TMJ more susceptible to pain. Not only that, you can develop coping strategies such as teeth clenching and grinding, just like we talked about, which can contribute to TMJ. You have things like increased cortisol, which can contribute to inflammation. So, no, really what I think I wanted to try to parlay all that together was all of that and what we've just talked about has almost this loop or cycle together. There is this intertwinedness to how the nervous system, stress, breathing, pain, chewing, all of that can come and play ties to each other. So we want to make sure that we can predict this and who needs to really understand this and be worried about this. And if there are predictors, what are they, so you can understand that to yourself. So Doc, do you want to just touch on the predictors of jaw dysfunction and what that looks like?
Perfect. So when you look at someone that maybe doesn't have jaw pain or could be susceptible to jaw pain, a lot of it will come down to, one, have you had trauma to the area, more vehicle accidents, fights? Then it's going to come into, like we said before, stress is obviously going to be a huge factor. Is that stress at home? Is it at job? Is it all day around? Is it a combination of both? Is it certain situations that you find yourself in with just a few certain people? Obviously, you would want to limit that interaction. Then it'll go into chronic chewing of gum. And this is where people can build up habits and can just feel a lot of tension in the jaw. We also have, if there's anything going on with the teeth or infections of the tooth, which will affect you to chew on more on one side than the other, that can also affect the tissues of the jaw functioning properly. And then as we go into, and I do want to touch on this topic, sleeping positions. If you're sleeping on your stomach and your head's turned to the side, I know we touched on this in the sleep episode with the tension of the neck and how that can twist the rib cage and the whole body from there, but also taking a factor of the jaw. So if your head's turned, or even if you're laying on your side with a little bit of rotation, your jaw can be relaxed and it can be almost compressed into the side in which you're laying, which when you stand up against gravity, that can put excessive pulling tension on some of the lateral ligaments, stabilizing that jaw in place. Thus why back sleepers have the best results long term in terms of functionality, less pain for the whole structure. So if you do have to sleep on your side, if you do have to sleep on your stomach, God forbid, pay attention to what way is your head turning. And when you're laying in that position, do you feel excessive pressure stretch on your jaw? If not, try turning your head the opposite direction. Do you feel a difference with just your jaw? Because if you do, you might have to do some maintenance work, which we'll get to in a little bit, on how you can maintain that moving forward. But yeah, Doc, is there anything you have on that?
No, I think that's going to be most of the predictors that I would expect jaw dysfunction to present with if you have any of that. I chewed gum a lot, so a lot of these, when I'm reading on them, again, malocclusion, I had braces, I've had issues with stress and anxiety. I don't think I've had any trauma to my jaw, but again, a lot of these add up already for myself who has TMJ issues. So when you look at that and you're reading that list, or you're looking at the things that we just talked about, and then some of them are starting to add up, you're like, oh, I do that. Oh, I have that. Oh, and well, let's say you don't have jaw pain, significant jaw pain yet. Maybe you just have some. Definitely want to start thinking about that. Maybe you don't have any. Still start thinking about that, because it's hell. It's hell. Again, when you rely on your mouth at least 3 to 4 times a day when you're eating your food, and you have wicked teeth pain, it sucks. I'm going to tell you right now, it sucks. It's also such a pain that's, for me, what I would explain it as, it's so shooting. It's a shooting pain. I think the structures involved around the jaw do have such a presence to the nervous system, so that they do report quickly, in my opinion. Or it's such a pain that is so nagging, cumbersome, painful. It's exhausting. So I really would, if you have those things already and you don't have jaw pain yet, please take care of them, or please take a look at them so that you don't have that.
Yeah, and then where do you go if you do have jaw pain? I've talked to many dentists before. Some specialize in jaw muscle PT work. Very rarely do you see it. I got a chance to talk to a few dentists, and they don't teach that in school, at least last 5-10 years. Before then, I don't think they did too much, unless you go out into other specialties, much the same with chiropractic. There's a bunch of different techniques and how you can adjust and treat someone. I think it's probably also very similar to dentists. Some dentists may treat it, some may not. I think my past experience, when you look at jaw discomfort, chiropractors, physical therapists are probably some of the best resources, but you want to look for someone that has had a decent amount of experience but is open and willing to learning and trying new things. Typically, a younger doctor, probably after experience of anywhere from 5 to 10 years, is probably a good ballpark, but again, that varies on all sorts.
TMJ specialists, I mean, if someone is stating that they had, or at least see a lot of TMJ, or are willing to see a lot of TMJ, that's usually a good sign. You don't find a lot of people marketing for something that they don't want to see. So
very true.
I would expect that if they're putting it out there that they see TMJ issues and they're very, well versed on that, then that's a good thing. I've noticed, even the dentist that I went to, a younger woman. So again, I think it's still an emerging topic and an emerging field in pain management and pain med. So yeah, I wouldn't say that I have met too many docs over the age of 40 or 50 that would say that they've wanted to specialize in TMJ. So
very
for sure.
Rare.
Yep. So lastly, I think one that everyone is always interested in hearing about, tools to help improve the longevity of your jaw, or tools to even help manage TMJ issues. Doc, what do you got for us?
Beautiful. Let's go at a few different tools here. First off, there's one small muscle that I always love saying, tensor velini palatini. It's probably by some French dude, I think we learned about him. It's a small muscle which is on the back top portion row of your mouth. It's almost like up and around the corner, and that helps regulate pressure in the deep auditory canal. So like if you are going in a plane and you notice your ears fill up, if you want to re-regulate that pressure, you can put your pointer finger on the top row of your mouth, goes back as far on the outside portion as you can, and then curve inwards. A little bit of pressure, anywhere from like 5 to 20 seconds, only on one side, can help regulate for both. If you do both sides, everything's just going to tighten up on top of the soft palate or the roof of your mouth. So if you want to, I can kind of go through this. Roof, around the corner, and it's up a little bit more. It kind of sucks to get to, and it can be painful and tender, but it's something that you can get to. If you don't feel comfortable, again, look for a TMJ specialist. A lot of them honestly don't have any clue of that muscle even exists. And it also helps with yawning and swallowing for the pressure difference, which I thought was kind of cool. And now as we go into stretches, exercises of the jaw, it's best to have a good understanding of the assessments. Now, most people, if they open and close their mouth, they may notice that their jaw might deviate to side and come back to center. So ideally go up to a mirror, slowly open and close. If your jaw deviates to a side, notice how far opening does that happen. If we go back to some of the anatomy at the beginning of the podcast, we'll know, okay, one of which, what controls side-to-side deviation? It's the muscle behind the angle of the jaw. So if you slowly open your mouth and your jaw shifts from me to my right side and back, I want to put pressure and tension behind the angle of the jaw for about anywhere from 5 to 10 seconds. You can open and close your mouth while you're holding pressure, kind of like a pin and stretch. Let's say you do that 3 to 4 times. I don't want you to go overboard with this. The muscles of the jaw, because we're eating, talking, swallowing, there's a lot of different actions. They can be overused easily, so it's hard to break down muscle tension, if we will. The other one is the lateral pterygoid on the opposite side. So again, below the cheekbone, slide back. There's going to be a little groove right in front of your ear canal. You can hold pressure on both those sides. Open and close the lateral pterygoid. That's way more, you feel more pressure, discomfort. And there's a lot of supporting structures with that as well. Those are going to be awesome ways. Now, if you also have a few other tools that you can utilize, some of which this is known as the pterygoid reset. If you hold either on the point of the lateral pterygoid right in front of the ear canal or behind the angle of your jaw, if you flex forward, you can do this both sides at a time. Flex forward your chin all the way to your chest. Rotate as far as you can, tilt, and hold that area for 30 seconds. And that was just behind the angle of the jaw for people that are not watching. Let's try to do the same thing for the lateral pterygoid or the pressure point right in front of the ear. If we flex all the way forward, rotate as far as we can, tilt. Doesn't have the same effect, but you can still feel that pressure. So ideally, I would probably look the one behind the angle of the jaw, but certain people are different. Another approach that you can do, a tool to reset, again, behind the angle of the jaw for the medial pterygoid, flex your chin forward, hold that pressure, and hold there for about 30 seconds. Once you notice pressure and tension start to release, you can relax. That one can be done maybe on every other day, maybe every third day. You can go once a day if you like, but pay attention to soreness, because if you start working on some of these tissues, other compensations can take place as well. So there's a few things there. There's a few other ways in terms of a pin and stretch. So if you just want to do manual muscle work and just putting pressure on one area, going back to the superficial muscles of the masseter. So that's the muscle on the outside portion of your jaw, right kind of by the angle of the jaw. Those are the ones that, if you clench down, that are very stressful. They can have a lot of pressure tender points with that. If you put pressure inwards, it can be both sides at a time or one side. Open and close your mouth. That can bring some relief. The other one I think not many people know about, it's the temporalis, which helps close the jaw. So if you put pressure, and ideally I like doing both sides, but you can do one side at a time, on top of your ears, move a little bit forward, right above your ear canal, and put pressure into your skull and up. So in and up, open, and then slowly close your jaw. And as you're closing your jaw, you're putting upwards pressure. It's forcing more of an eccentric contraction or a lengthening of those tissues, which can help ease up tension. That's also, if you do notice your jaw deviate to the side, you want to go at the same side it deviates as well with that one. So top of your roof of your ear, pressure in and up as you slowly close. That'll work really, really well. Now let's go into some of the unique ones that's, honestly, I don't even know if I've shared with a lot of patients before. I've done with a couple people here and there, but this is going to involve movement of the jaw, movement of the neck, and either stabilization or movement of the upper back, torso, shoulders. So let's look at this in multiple areas in which your body can move and your jaw can move. So when we go into this, to lengthen tension underneath the jaw, especially for desk workers that sit on the computer, heads coming forward, we want to start by tilting your head backwards, making sure that there's no sharp pinching pain in the back of your skull. If there is, I would strongly suggest seeing a chiropractor, getting that squared away before going into this. But if you don't have any pain with that, perfect, let's continue. Now we want to make sure we add muscle contraction. So we're lengthening the tissues already. Let's move the chin in multiple areas. I look at this kind of like the around the world, so we can target all lines and stresses of tissues for all areas from the bottom of the chin to the sternum. So as we extend our head backwards, we're going to be deviating our jaw out to the side, almost to the 45-degree angle, straight up and down, off to the side. So I'll kind of demonstrate this here. So we can start side, and you can go slower. You can feel more pressure, tension at certain areas, especially side-to-side movements. Again, this is something that you want to work towards. If you want to take that to the next level, either trying to depress your shoulders down, hold weights in your hand, do the same thing, and then lead with the jaw. I wouldn't start there. Definitely want to build up. Maybe give it a couple weeks of consistent movements with this, maybe working on this for most people on average 1 to 2 times a week. You can probably go up to 3 times, but again, you don't want to overdo some of these tissues. The other one is, okay, now as we went to head extension, we can also do neck flexion, which a lot of this again goes back to targeting the tension headaches. Now for this one, I like to go against resistance because a lot of us can nod, no pain, discomfort. It's something that we naturally did at a younger age. Oftentimes we don't do yes or no movements. It's all through the mouth, the jaw. So if we put pressure on the top of our head as our chin's tucked to our chest, and then we try to tilt our head backwards, you're going to notice a contraction at the base of your skull. Again, make sure there's no sharp pain, but you also notice an eccentric motion of all the tissues from the sternum to the chin, if we will. So again, top of your head, light resistance down. You're going to try to lead with your chin, coming back into extension. You can also do this in multiple different angles. So if you come down, try to turn up to the side. I would just keep it at a 45-degree angle and anywhere in between the center. If you start going off to the side, that's going to go into the next one, which you can have better use of your time this way. So let's go into lateral tilting of the head. So we're going to tilt your head to the side, again, making sure there's no pain pinching. From here, we want to stress all the tissues on the outside portion. Now for these, you're going to notice some of the muscles that attach from the neck. A lot of them will go down to the rib cage, known as the scalenes. There's also muscles on the backside, front side, but more or less targeting the jaw. If we tilt to the side, I want you almost putting pressure up and deviate your chin up to the sky. You can tilt opposite, tilt up. You can stay on one side and then just try to do deviations back and forth, which has a muscle component. It also has a stretching component going to the eccentric contraction for the tissues more in the upper back chest, which will help bleed energy into more of the tendinous structures or where the muscles attach to the bone, because if the muscles have more work done on them, they can almost blow out some of the tendons, and there's a lot of guarding that can ensue from there. Okay, so we went through flexion, extension, tilting. Next one is rotation. Because of the muscle of the omohyoid bone, which goes from the hyoid down to the scapula, we want to make sure we're involving not only the shoulder blade, but also the whole shoulder complex. So I'll start in different levels with this one. We can start by turning your head to the side. From there, I want you almost rotating. Whatever way you turn, that same side jaw is going to be facing more outwards. I want you almost rotating your jaw with it to that same side. So if you're watching this video, I'm turning my head to my left, and I'm trying to turn my jaw to the left as well, which you often feel stretch and pressure behind my right angle of the jaw. You can go into more of a stretch with this one. I'll do it to the other side, putting pressure behind the angle of the jaw. Anywhere from about 20, 30 seconds at a time. Ideally, you want to build up to 2 minutes total, which research has showed to fascial plasticity. I don't think that's ever been done with the tissues of the jaw, just with all the other muscles. So again, pay attention to the soreness. Now let's take this one step further. Hold your thumb behind the angle of the jaw and then try to bring your jaw backwards, or hold pressure and then try to squeeze that muscle, which that'll bleed energy into the tendons, ligaments on the back side. Now, if we want to incorporate the muscles and communication from the neck and the jaw together, this would be another one to where we turn, same movement, hold behind the angle of the jaw, lead with your jaw backwards, and then turn your head to the opposite direction. I almost think about this in terms of scapular rows. We want to lead with our shoulder blade first and then continue the row. Same thing, lead with the jaw first and then go through the rest with the turning of the head. Another step forward, if you want to either depress your shoulder downwards, the opposite shoulder in which you're turning your head, either holding a weight in your hands or putting pressure of your shoulder up against the wall so the tissues are lengthened on the upper back. Again, leading with the jaw, turning your head, and you can do the same thing back and forth. So that gets the rotational aspect, that gets the tilting, the flexion, extension. It's addressing all the muscles between the hyoid bone in the chin, the hyoid bone, the sternum, the hyoid bone, the rib cage, the hyoid bone, the scapula and shoulder complex. It involves everything as a whole. Now, the strength in your neck, oftentimes you see people going through machines that just go into neck flexion, and oftentimes you see people going in various directions. I would strongly suggest going through movements, starting off with on a weekly basis, 1 time a week, going through these movements. And then probably, let's say a couple weeks in a row, then you can go into every other week, and then I would go down to once a month. This will also build the stabilizing structures. So if you do get into an accident, if you do, God forbid, get into a fight unless situations come up, that blow, that withstand pressure, your body can withstand that much easier because of the supporting structures of the tissues that you have around there. Next, on top of the neck extension, which we did with communication with the jaw more eccentrically, let's work on the tissues at the back of the neck. So we hold behind the base of our head and then try to bring our head backwards. It's going to be a nice isometric contraction as all the tissues are lengthened, which can help bleed a lot of the energy into the tendons between the base of the skull and the neck. This will also help with tension headaches to a certain regard as well. Also, if we go into holding the jaw, the back of the head, and then try to turn back and extend. Kind of like, so if you're not watching this, I'm holding, like I said, the back of the head, the jaw, and I'm trying to bring my head backwards and turn to the same side I'm holding. So it's resistance going back into rotation, which will help build up the tissues on the back outside portion of the neck. So between all of those, we're targeting all the muscles of the back of the neck, the side of the neck, the front of the neck, and how everything of the torso shoulder complex gets brought up to the chin. Now, there's a lot of stuff with that, but I would suggest going back through each and every one of these tools, utilizing this on an everyday basis. I have not found anyone that has broke down the muscle exercise portion of what we just went through, and also a lot of which the muscle pin stretch movements that we've been through. So a lot of this will help significantly ease up pain discomfort. So if you're in a remote area, or if you know someone that is in pain, or if you are out of state, or send this video, this podcast to friends and family. We're going to break this down in the short form as well, but there's just so many applicable tools that can help for the maintenance of your jaw and neck long term, which can prevent all of these other symptoms throughout.
Absolutely.
So, yeah.
And I agree. I have yet to see someone break it down like we've just broke it down today. Seriously. So great job, Doc. Seriously.
Appreciate you too.
I'm going to use them. I think that's all for today. So that's all we have for you. Thank you guys so much for watching again. We appreciate every single one of you, those that have continued to watch us, share our content, like, subscribe. We really do appreciate you guys. And thank you guys so much. We look forward to seeing you guys on the next podcast. Doc? See you guys later.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.